Thank you. Hello, everyone. Thank you for joining us today for this webinar. We know that your time is extremely valuable, and we appreciate the fact that you've taken some time today to listen to this webinar on the important topic of workplace policies that prioritize maternal and child health. My name is Manel Capagoda, and I will be your moderator today. This is how we'll use our time together. As everybody listening to this webinar no doubt can attest to, the workplace can be stressful. In particular, the workplace can be a stressor for pregnant women and mothers if they don't receive the support they need, such as lactation accommodation, pregnancy and parental leave, and resources to achieve a healthy work-family fit or balance. This webinar will introduce research linking workplace policies to women's health and highlight strategies for making workplaces more supportive and equitable. Participants will learn about national trends in supportive workplace policies, and we're also going to hear about a really innovative local collaboration that places the health of women front and center. We have some fantastic speakers today. All of our presenters are nationally recognized experts on workplace policy and public health. First, Dr. Erica Sabbath will discuss the research on the health impact of workplace policies and practices on women and families. Dr. Sabbath is an epidemiologist and assistant professor at Boston College School of Social Work. Next, Dr. Curtis Chan and Sharon Turman will describe San Francisco's Healthy Mothers Workplace Coalition, a collaboration of government agencies, nonprofit organizations, and employers that aims to promote workplace policies that benefit maternal and child health. Dr. Chan is the Medical Director of Maternal, Child, and Adolescent Health for the San Francisco Department of Public Health. Sharon Turman is Director of the Work and Family Program and a Senior Staff Attorney at Legal Aid Society Employment Law Center based in San Francisco. And finally, Celia Recio from Moms Rising will describe Moms Rising's campaigns to push for more supportive workplace policies. Ms. Recio is a state organizer at Moms Rising. Before we dive in, I'll give a little background about ChangeLab Solutions and the genesis of this webinar. ChangeLab Solutions creates innovative laws and policies to ensure everyday health for all and to promote just and thriving communities. We also see it as part of our mission to make connections between research and practice and to highlight promising and emerging strategies in the field of public health policy. It's in that spirit that we present this webinar on workplace policies that promote maternal child health. Today's webinar is funded in part by the Robert Wood Johnson Foundation. ChangeLab Solutions is a technical assistance provider for the Foundation's Healthy Weight initiative. Before I turn things over to the speakers, I'm just going to run through a few housekeeping matters. So after the webinar, a recording of the event and a PDF of our slides will be made available to you. We'll also send you an evaluation that we are actually going to use for some of our program planning here at ChangeLab Solutions. So we'd really appreciate it if you could take 5 minutes and complete that for us. We want to encourage your questions. So we've left time at the end of the webinar for questions, but we also encourage you to ask the presenters questions throughout the event. If the presenters can, they'll answer them immediately, or we'll hold them until the end. To ask a question, please enter it into the chat box. And to make sure that people are comfortable using the chat box, we're going to get your fingers and your keyboards warmed up right now by asking you a question. So the question is, are you already working on healthy workplace policies? Have you done any work on workplace policies? And it doesn't necessarily have to be policies that are focused on maternal and child health specifically, but can you just take a minute and type in anything that you've worked on in terms of healthy workplaces? And I don't think that participants can see the comments that are coming in, so I'm just going to take a minute as people are doing what I asked and warming up their keyboards to tell folks what's coming in. So people have worked on healthy meeting policies. We have an answer. We're working on developing a, wow, I'm getting so many answers. Hang on, I lost my space here. We're developing a healthy maternal child preparation program, which has leadership development component. We're working on breastfeeding policies, vending policies, healthy workplace toolkit for breastfeeding, lactation accommodation, paid family leave, just starting working on lactation support policies. Great. Well, you are at the right webinar. And I'm looking forward to getting lots of comments and questions as our speakers, as we listen to our speakers. So right now, I'm going to turn it over to our first presenter, Dr. Erica Sabbath. Erica, over to you.
Thank you so much, Manal. Today, I'm going to be giving kind of a high-level view of what the work-family landscape in the U.S. is, how it's evolved, how work-family policies impact health both in the short and the long term, to help give a frame for why these issues are so important. To start off with, there has been a huge change over the past half-century in the way that women, in particular, combine work and family in the U.S. In 1975, about half of mothers were in the labor force. That rose to about 71% by 2008. And at the same time, the share of births to unmarried women has increased almost linearly over that time. And when you put these two figures together, what you can glean is that women are having to balance work and family responsibilities in a way that they never have before in the U.S., often without the support of a spouse, which could create a lot of difficulties in terms of how to balance these two roles. Before we get started on kind of the gloom and doom about how work-family issues and policies can impact health, I want to start with the good news, which is that being a working mother is really good for your health. Working is good for your health, being a mother is good for your health, and being married is good for your health. And when you put these together, they are very beneficial for health. My team did a study looking at the way that women combined work, marriage, and having children from ages 18 to 50. And what we found is that the people who were the least likely to die prematurely were the ones who did combine marriage, working, and having a child. And kind of in the middle were stay-at-home mothers. And what this kind of demonstrates is that there are really positive effects to continuing to stay in the workforce. The less good news is that this effect often goes away when the presence of a supportive spouse is taken away. The women who had the highest mortality in our study were the working mothers who did not have a spouse for the majority of their life, or who were mothers and were single and not working. That being said, in the short term, experiencing conflict between work and family can be harmful to your health. And this has been shown in a whole variety of different health outcomes. Experiencing conflict between work and family roles to the point where the issues of one spill over into the other has been associated with health problems in women ranging from poor sleep to absenteeism from work, mental health problems, heart disease risk, poor self-rated health, and then also some things that kind of fall along the pathway to poor health that are often used as coping mechanisms for when the balance between work and family is really hard. So, for example, overeating, increasing your BMI, smoking and alcohol, or not being able to take the time to be physically active. One study in particular that I want to highlight shows the flip side of this, which is that in a workplace, a supportive manager can really have a direct benefit on an employee's health. This was a study that was done in nursing homes looking at low-wage workers, and what we did was we interviewed nurse managers about their support and openness and creativity for work-family issues among their employees. And what we found is that the difference in the amount of sleep that the average worker got, comparing someone who had a very supportive manager to having a very unsupportive manager, was almost half an hour of sleep per night. And we were able to track sleep using a watch, kind of like a Fitbit, that can track the amount that you're sleeping. And this is a really big finding, and it shows that managers really can impact the health of their employees through their openness and creativity about accommodating workers' work-family needs, and kind of recognizing that there isn't a one-size-fits-all policy, but that managers working with individual workers can really help improve the health of employees. And some other research that is kind of hot off the presses, it was just published a few weeks ago, finds that these health benefits extend not only to employees but also to their children. There was a large worksite intervention that grew out of the data on the last slide, in which in a large company, managers were taught how to improve workplace policies, how to make their workers better able to balance work and family, either in terms of flexible scheduling or making meetings optional. And what they found is when they interviewed the children of these workers, the children of people who were in the intervention group, rather than those who did not receive this intervention, they slept better, more deeply, and more consistently. And especially in children, sleep is a very important predictor of health. We also found that parents who were part of this intervention study not only had healthier children, but also were able to spend more quality time with their children. So they spent an average of almost 40 minutes a day longer having high-quality interaction with their kids. And especially for a working parent, 40 minutes is a lot of time. You know, that is crucial bonding time, especially when your children are young or when they're adolescents and kind of need parental time differently. When we look at what policies the U.S. and around the world has to bring to this issue of how to balance work and family, there are some very clear patterns that emerge. And this is a map that shows across the world the average amount of paid leave, this is paid in particular leave, that is guaranteed to new mothers upon the birth of a child. And you can see that the general pattern is that in Europe, people often have over a year to have with their young children. And in almost the entire world, there is at least kind of a 3-month guaranteed paid period. And as I'm sure you all are aware, but I feel like this map shows it in very sharp relief, the U.S. is a huge outlier in this area. There is no paid leave. There is the Family and Medical Leave Act guarantees that your job will be held for 12 weeks, but it is unpaid time, and often, especially for people in low-wage jobs or people who don't have vacation so they can't save up vacation, it comes down to a really difficult choice between bonding with an infant and recovering from childbirth versus providing for their family, especially for women who are in those more precarious family situations where they don't necessarily have a spouse or other help that can be useful to help care for that infant or bring in income right after a child is born. And these policies don't just sort of pay dividends in the child's first couple months of life, but they can impact maternal health for years. This on this slide highlights a study that was just published last year, and this is using maternity leave data from the 70s. And in Europe, maternity leave policies, especially paid leave, has been guaranteed for a long time. And what we did was we looked at different countries and the amount of statutory paid leave that a woman was entitled to upon the birth of her first child. And what we found is that the more generous the leave policy was when someone was young, the lower their depression risk was up to 30 years later. So again, these policies don't just pay in the short term, but they can affect women's health for the rest of their lives. And the U.S. could not be included in this analysis because there is no paid leave in the U.S., and you can't analyze what someone's depression is based on the amount of paid leave they have if their paid leave is zero, which kind of, again, calls to attention that in the U.S. this is a huge gap, is potentially leading to more health problems down the road. In terms of what flexibility or what work-family balance might look like on a day-to-day basis, what I'm going to do here is I'm going to just highlight the gap between what is often done and what workers really would like. This is a study that was done at a large hospital system, and workers were asked, how important is it for you to be able to take off a few hours during regularly scheduled work for personal reasons? And almost everybody said it was very important, both employees and managers. But then they were asked, over the past 2 months, how often did you actually take a couple hours to accommodate personal needs? And very few workers, especially low-wage workers, said that they actually did. So there's a mismatch between what people feel is important and what they are actually able to do. And there's been a lot of research into what is the explanation for this gap between policy and practice. And some of the conclusions is that the policies that we have for helping people balance work and family, both right after a child is born and also as children's lives progress, and even extending into issues of elder care and people who are caring for both elderly parents and children, the policies have focused on flexible scheduling, job sharing, and parental leave. But just because those policies are available doesn't mean that people actually use them. And in looking into the reasons why people don't uptake these policies, especially low-wage workers feel that there will be some kind of unspoken penalty for taking advantage of flexibility or leave. Women in particular who have just had children often fear what they call the mommy penalty of not wanting to seem committed to the workplace, not wanting to seem like they're trying to shirk their duty. And the people who take advantage of those policies are often the ones who don't always need them in the first place. So managers, for example, often have more latitude, and they're the ones who do take a couple hours here and there to take their kids to a doctor's appointment. And the recognition that is growing is that, yes, it is very important to have these policies on the books, but what's even more important is changing organizational culture so that people feel empowered to use those policies. And that they don't just see the policies as this is something for somebody else, this is for someone who is secure in their job, who doesn't really need this, but this is a policy that can benefit everyone from the CEO to an hourly worker. And so that seems to be the direction that work-family interventions are now moving, is how do we change workplace culture? And with that, I will turn it over to Curtis and Sharon.
Thank you, Dr. Sabbath, for the excellent summary about the health impact, what we can do about that, and mentioning about changing organizational cultures. We'll share our county's experience and hope that participants can email Sharon and myself or the group about your experiences. My clinical experience as a primary care pediatrician caring for babies and families affirms the immense public health epidemiological disparities we've seen as a county. For example, at the 2-week well child checkup, mothers insured with Medicaid would tell me that their employer is requiring her to return to work full-time, while mothers in selected white-collar professions could choose to bond naturally with their infants. This inequity of parental leave is that precise unequal starting line that leads to a life course of an uneven playing field. So this shared concern about this health inequity and these policies brought together nonprofit organizations, governmental agencies, and employers 5 years ago to improve the working conditions and health of new parents and their families in San Francisco. So as you can see in this next slide, this is one of our logic frameworks, and what we've done is combine the spectrum of prevention as a focal point for our collective impact of mutually reinforcing activities of our Healthy Mothers Workplace Coalition, which is a coalition that's now being led by the Employment Law Center. So in terms of changing organizational policies, we thought the most feasible and effective approach would be to initially focus on developing a Healthy Mothers Workplace Award program that's focused on parental leave, lactation accommodation, and work-family balance. We thought that by changing voluntary organizational policies first, that would drive the health education and information that would be shared by employers, elected officials, community organizations, and healthcare providers. And that is, in fact, what has happened. By supporting the Healthy Mothers Workplace Coalition, we now have things like our 5 hospitals engaged and interested and committed to disseminating Healthy Mothers Workplace toolkits, fact sheets related to pregnancy and caregiving. And at the same time, upstream, we've had local elected officials, our Board of Supervisors, and the Mayor's Office interested in these issues, which has led to local ordinances. And these ordinances and this process, Sharon will describe more in detail. So the physical and mental health issues during the critical pregnancy and postpartum newborn period can affect the life course of health outcomes, as Dr. Sabbath mentioned. So for our county, analyzing our county birth data in context with MIHA and throughout the United States PRAMS data, we did this in context with the research in health that Dr. Sabbath summarized, and this reflected that the majority of women with Medicaid, that is, those who did not have private insurance provided by employer, were in fact actually working during their pregnancies. And these women insured by Medicaid were several folds more likely to lose a job, have no practical or emotional support, have a prior likelihood of low birth weight or preterm birth, and have postpartum depressive symptoms. All these outcomes are related to working. So this work is aligned with the major national public health frameworks and strategies. By informing policies at workplaces and prenatal and postpartum health care, we can achieve the national prevention strategies that all of our communities are supporting. And these strategies also empower people and eliminate gender, class, racial disparities of multiple health problems. As you can see, our Healthy Mothers Workplace was initiated by the County Health Department, initially in conjunction with the Breastfeeding Promotion Coalition, the Department on Status of Women, and other nonprofit and governmental agencies in 2011. Our investment from the government has been pretty small. It's been initially only $25,000 through the CDC's Community Transformation Grant. In the last few years, the backbone organization has been the Legal Aid Society Employment Law Center, which really not only serves as a backbone organization, but is our lead provider of technical assistance and expertise. And through their leadership and the involvement of the community, we've developed policies that affect workplace policies that affect, on the left-hand side, healthy and safe community environments, as well as providing new policies and systems for screening and information on employment issues during pregnancy and the postpartum period, which empower the clinical and community preventive services. as many of you know, the Surgeon General call to action was very clear in developing policies towards working towards an established paid parental leave for all employed mothers, developing lactation support, and the 15th action was developing basically family-friendly workplaces. We directly implemented these 3 calls to action into our Healthy Mothers Workplace Assessment Framework. Many of you are familiar with this RWJF-funded study that affirmed that physicians wanted to prescribe employment assistance. Physicians have this unique opportunity to screen and counsel patients during the quick transitions of pregnancy and the postpartum period regarding protections that just became relevant to their pregnancy and their new change in life. Many of you are also aware of the Raising of America and screening this sequel of Unnatural Causes in your community. And as you know, one of the major focus areas of this film is on the health impact of workplace conditions on young children and families. In order to develop practical tools to change community environments and clinical systems in our county, we are so grateful to have partnered with the talented and committed lawyers at the Legal Aid Society Employment Law Center, who serve as technical experts and as our backbone organization. So with that, Sharon.
Thank you, Curtis. So I'm going to give a brief overview of the Healthy Mothers Workplace Initiative in San Francisco. I'll say a little bit more details about that. But first I want to just briefly say a word about the Legal Aid Society Employment Law Center. We're a nonprofit public interest legal organization that was founded 100 years ago in 1916. And we advance justice and economic opportunity for low-income people and their families. And our work and family program focuses specifically on the workplace rights of low-income pregnant women, new parents, and caregivers to basic protections like time off work, paid leave, and accommodations. We have a toll-free work and family helpline, and we hear from nearly 2,000 people every year with who are struggling with the difficult choices that Dr. Sabbath mentioned earlier. You know, do I bond with my child or do I keep my job? And we give legal advice to people. We represent them when their rights are violated. We do community outreach and education. And we do policy advocacy to expand family-friendly workplace policy. So we have had the great pleasure of collaborating with Dr. Chan and DPH in San Francisco and the Healthy Mothers Workplace Coalition over the past few years to encourage employers in San Francisco to voluntarily adopt better policies for working parents. And what we've done is we've developed a one-page self-assessment that employers complete, and it covers 3 categories of policies that affect the health and equity of working parents. First, pregnancy and parental leave. Second, lactation accommodations. And third, work-family balance. And employers who complete the assessment are eligible to receive a bronze, silver, or gold award. Bronze generally corresponds to the actual current legal requirements under federal, state, and local laws, and it might seem a little odd to award people for just complying with the law, but the coalition felt it was important to do that so that we could also use the assessment as an education tool. We know that many employers don't comply with the law, and in filling out the assessment they may learn, oh, I do have this obligation. And then it also provides them with concrete ideas about how to go above and beyond the law. So silver awardees must meet all the bronze requirements, and then they must do more than what is required on each of the 3 categories. So for example, not only would they have to provide unpaid leave for pregnancy and bonding, but they would have to provide some amount of employer-provided paid leave. And then gold awardees would meet the bronze and silver requirements and then do even more to make their workplaces family-friendly. again on all 3 categories. So this could include additional comforts in a lactation space. It could include a babies at work policy, on-site child care, or child care subsidies. In terms of the outcomes of the Healthy Mothers Workplace Award Program, we've been doing the awards for 3 years. We've held annual awards ceremonies that feature public officials and advocates and city leaders where we've recognized these employers who have family-friendly workplace policies. We've given 75 awards over the past 3 years, and each year there's been increasing participation and diversity and attention. Last year, Santa Clara County launched a similar awards program that was modeled off of the San Francisco program. Last year, 33 employers received awards affecting thousands of employees, and they ranged from a retail market to law firms, nonprofits, UC San Francisco, U.S. Department of Labor, Twitter, so a wide range of employers. The mayor also encouraged all city departments to apply for the award, and several local departments were honored. And the mayor selected this initiative as a top 10 innovation for San Francisco at last year's U.S. Conference of Mayors. One thing that's really important and I think notable is that several employers improved their policies to move up a level. And others upgraded their policies before they even submitted their application so that they could qualify for a higher level award. So just to give one example, Buy Right, which is a local gourmet market in San Francisco, in the program's second year, implemented paid leave and improved their lactation policy and their lactation room in order to qualify for a silver award. And their HR director spoke at our award ceremony about how this initiative inspired her to implement those changes. The U.S. Department of Labor also improved their nursing mothers policies in their lactation room, including providing hospital-grade pumps as a direct result of this initiative. And that's the real goal of this program, is to give employers ideas for how they can improve the lives of their employees and then to celebrate them for supporting working parents. So one other thing that we do toward that end is we offer educational workshops and technical assistance, a toolkit with sample policies for employers, and so that we can show employers the benefits of these policies, which, as we all know, not only impact the health and well-being of parents and children, but also can have real benefits for employers in terms of reduced turnover costs, lower absenteeism, higher productivity, and better morale. In addition to our work changing workplace policies, the Coalition, as Curtis mentioned, also has worked to integrate legal information about existing workplace rights into healthcare delivery for low-income pregnant women. There are already several laws on the books that can impact the health of parents and children, but many low-income workers don't know about these laws. Let's just give one example. California is one of the few states in the country that has a paid family leave program, but a recent poll showed that only 36% of California voters were even aware that the program existed. So this program of integrating information into healthcare delivery has been a really innovative way to make sure that people know about their rights and can access them. And the reason why we've decided to work with healthcare is that virtually all pregnant women receive prenatal care. And so it's a really important way to reach people who otherwise may not know of their rights. So starting a couple years ago in collaboration with Department of Public Health and SF General, our safety net hospital, we've provided trainings and technical assistance to prenatal care providers on their patients' employment rights. We've created fact sheets like the one shown here and disseminated them in multiple languages. We have posters and postcards in every exam room where women receive prenatal care. Providers are screening pregnant patients for employment-related concerns and then referring them to legal aid for assistance. And we have on-site legal assistance while patients are waiting for their appointments. And we've seen that this work has been effective. In particular, the trainings for providers have been effective. We did a baseline survey showing that providers, by and large, really did not have knowledge of their patients' workplace rights, but after the trainings, they reported increased knowledge about their patients' rights, increased capacity to address employment issues, increased attention to employment concerns, and increased referrals to legal services. And finally, I wanted to note that another key component of our coalition's work has been to shape local public policy. We provided technical assistance and testimony on 2 recent landmark laws, the Family Friendly Workplace Ordinance in 2013 and the Paid Parental Leave Ordinance, which was just signed into law this year and is the first law in the country to mandate fully paid parental leave. Curtis Chan, on behalf of DPH, provided key testimony on the health impact of both of these measures, and coalition partners helped inform and draft the proposals. And lastly, the coalition has been working to inform state and federal work-family policy. On the state level, we've had several successes in recent years, expanding paid family leave, guaranteeing paid sick days. There's more work to do, including working on a bill to extend job-protected bonding leave to more parents. And on the federal level, we've had one major success over the last several years, which was lactation accommodations, which was passed as part of the Affordable Care Act. Other federal measures like paid family leave and paid sick days are still pending, but the work that our coalition and other coalitions around the country are doing on the local and state level can really help influence these national proposals. And as we gather more evidence on the positive health impacts of local and state family-friendly workplace laws, we can make a stronger case for federal legislation. So with that, I will turn it over to Celie.
Thanks, Sharon. I appreciate that. There is so much amazing information shared here, and it resonates with some of the work that we do here at Moms Rising. So we are an online and on-the-ground grassroots organization working to increase family health and economic security. At this point, we're over 1 million members strong across the U.S., and that's important because we take action in various ways, including, if you guys might have heard, what we like to call click activism. And what we do is, those members take action on critical issues facing women, mothers, and families. And we try to educate and mobilize on the ground. This is important we do this through national outreaches, bringing our voices to the politicians and to the lawmakers. And one of, I think, the strongest things that we have are the voices of our members who tell us their stories. And we are careful to, make sure that those stories are heard because, as we've heard here, there's so many inadequacies right now, specifically with mothers and paid family leave and how that affects the family long term. So I wanted to share with you a couple of campaigns that we've done recently. And for me, I work as part of the Workplace Justice Campaign, and that means that we focus on issues such as paid family leave, paid sick days, and pregnancy workers' rights. And last year we had the great pleasure of being able to, pleasure in the fact that we were able to help, but not that this was a situation, that we were able to come together with regards to this situation with pregnant workers. And we were able to send out a couple of outreaches to our members in order to support Peggy Young, who was in a legal battle with UPS as she was being refused her request for light duty while she was pregnant. And we were able to collect over 30,000 signatures and messages of support. And we put it all together in a booklet and actually delivered it to both lawmakers and Peggy herself. And she was very grateful for the support, but our members were activated in that way. We felt very strongly and heard over and over again that no mother should have to choose between her job and the health of the pregnancy. It seems like common sense to so many of us, and it's difficult and sometimes infuriating to even come up with these issues these days and the fact that we're dealing with them. But our members mobilized and were able to, we were able to get that together and make sure that our voices were heard. And what I love about being able to send out outreaches like this is that we not only receive signatures, but we also receive stories, because this is a common thread that's happening across the country right now. The latest piece of the latest campaign that we had, we actually kind of did a tandem campaign for pregnancy and breastfeeding in the workplace. We held a webinar and a blab session in May around the topic of pregnancy and breastfeeding, and we invited the ACLU and A Better Balance to come and speak. And we went through so many of the questions that I think come up over and over again. For us, I feel we're working in this area, and a lot of times, we kind of take it for granted that people are understanding of things like FMLA and paid leave, when we all know that, only 13% of employees in the U.S. actually have paid family leave. So we wanted to bring that to the forefront and educate the viewers and educate the members that came to the Q&As and to the sessions. And what we did was we followed that up with some additional information. We sent out an email and outreach, and we asked that our members give the lawmakers and their member of Congress a summer reading project. And that summer reading project entailed delivering our booklet. And we've been collecting stories. We have a ton of stories around paid family leave, but we collected these gems regarding that really kind of tied paid family leave and breastfeeding, and how those two are connected, and how it affected so many mothers. I know that for me, it took me a while to get through all of the stories, having to read about mothers that had to go back to work after 9 days because they didn't have paid family leave, and how that affected the health of their baby and their need to breastfeed, or their want to breastfeed, and not being able to do that because of it. So we were really excited that we had almost 900 people that signed up to deliver these booklets to their local member of Congress. So again, this is just another way to mobilize our members. Certainly with, we have our signatures that we collect, and we deliver those whenever we can and whenever the time is right. But having a little bit of a different spin this summer with regards to bringing together the Q&A sessions as well as the stories directly to the members. And our members love getting involved like this. A lot of times I think we send off our signatures into the internet abyss, right? We know that they're being delivered, but this gives our members a chance to do something locally that is super important to us and to the families in the U.S. That is what I have now. I think that we're getting into our questions.
Yes, thank you, Celie. That was great, and thank you to all the presenters. Those were fascinating presentations. So I want to encourage folks to type questions into the chat box. We have a number of questions, so I'm going to work through the questions that have come in throughout the presentations. But while we're doing that, please listen to the answers, but also think about other questions that you may have. And the first question I'm not actually going to pull from the participants, but Celia, I'm just going to ask you, if let's say that Curtis and Sharon were working on a new policy that affected maternal child health in San Francisco, and they reached out to you and said, Moms Rising, can you help us with this policy? Can you just talk me through kind of what Moms Rising might do, how you might work with Curtis and Sharon?
Sure. It depends. We could sit down and maybe talk about mobilizing our members in that specific area, send them information about, hey, this is what's happening, this is what's going on. We also share a lot of information with our members across social media, right? So Twitter and Facebook, we've asked questions before of our members, and they've provided us information. So if it's something either collecting information or sharing, let's say you guys are having a town hall of some sort, definitely being able to provide that information. That's something that we're more than capable of doing. I also moderate our Wellness Wednesday chat that happen at 2 p.m. Eastern. So it might be that we come on one week and have a Q&A with our members, have us put the questions out there, and then get more information out to the people that follow that chat thread. So there could be, we could have multiple ways of helping and getting the word out or providing information or getting signatures. It really depends on the specific campaign and how it fits into the overall campaign areas that we're working on.
Yeah. And can people reach out to you directly, Celie, if they're working on these types of issues that focus on maternal child health in the workplace? Are you
Absolutely. Absolutely. Please, you can email me at celie@momsrising.org.
Great. Okay, I'm going to move to the questions from our presenters, from our participants and for our presenters. And the first question is for Erica, and it's about the data that you shared with us of the global policies. And the question is, do you break down fully paid leave versus partial paid leave in the world chart of who has paid leave benefits?
It has been broken down. I can picture the graphic in my head, but I don't have it at hand. If you want to email me at erica.sabbath, so first name dot last name @bc.edu, I will be happy to find it and send it to you, because it does break down the amount of weeks of paid and unpaid or full or partial pay by country.
Great, thank you. And I think we touched on this next question, but I want to raise it because of the personal nature of the question. But one of our participants would like the speakers to talk more about any national advocacy efforts to increase paid leave, paid maternity or paternity leave in the U.S. She says that the lack of leave is a huge challenge in the U.S., and she's experienced that as a full-time working mom of 3. And maybe Celie will start with you, but feel free to pass that on to Sharon or anyone else.
Sure thing. So, one of the things that we've been working on is trying to push for the Healthy Families Act, right? Because that's what's going to help nationally. I will say that even though sometimes that seems a little bit grim, we have had some successes. In April, New York was the next state to pass a paid family leave law. So it's going slow, but I actually feel great because we've had states kind of take it upon themselves, understanding that this needs to happen because of people like this that need it, that know what they're experiencing. So while we are working on these issues and these campaign areas nationally, we are constantly speaking with lawmakers as well as gathering signatures and information to pass on for the Healthy Families Act. We do have, I think, great momentum happening locally for paid family leave as well as paid sick days. We've had some great municipalities that have passed these laws because those are also important.
Great, thank you. Sharon, do you want to add anything to that?
Sure, yeah. So, as Celie mentioned, the Family Act and the Healthy Families Act are pending and sort of languishing at the moment in Congress, but there is a lot of interest, and I think with the current election, there's a lot of national attention to the issue of paternity and maternity leave. The other issue, aside from passing paid leave, is increasing access to unpaid job-protected leave, because many people are actually not covered by the Family and Medical Leave Act, which provides for 12 weeks of unpaid but job-protected time off. That law nationally only covers about 60% of the workforce, because there are some really strict legal requirements that you have to meet in order to be eligible. You have to have worked for a very large employer, you have to have worked there a year, and you have to have worked a certain number of hours in the year before you take leave. And so there are also efforts to expand access to job-protected leave, and really both are critical to enabling anyone to take time off. Both the knowledge that you'll have your job waiting for you when you come back to work, and that you'll have some access to pay during the leave.
And a follow-up question is, and I think this is talking specifically about San Francisco, but it could be more broader than that, is did the family leave policies that presenters have talked about include foster and adoptive parents? And just generally, do family leave policies include foster and adoptive parents?
Yes, they absolutely do. It's a really great question, and a lot of people don't realize that foster and adoptive parents are eligible for time off, for example, under the Family and Medical Leave Act, and in California, our version of that law. And they're also covered by the paid family leave law in California. And so foster and adoptive parents can receive partial pay while they're bonding with a new child who's come into their home. And then under San Francisco's newly enacted fully paid parental leave policy, foster and adoptive parents are also covered.
Great, thank you. This is a question for Curtis and also for Sharon. If communities are interested in replicating San Francisco's collaborative coalition, you talked briefly about the funding that you used to get this program going, but what would you recommend for folks in terms of figuring out how to get these types of efforts funded?
My opinion is that doing things like filling out the survey and very practical things like cutting and pasting all these excellent questions and chat comments are the things that are going to be able to fund collective impact nationwide. It's fabulous that ChangeLab Solutions and RWJ's culture of health hopefully will focus on these issues. And I think it requires all of us in our communities and our organizations to start considering this as a health issue. We all know this is a social justice issue, and as researchers like Dr. Sabbath and others throughout the country are bringing light to the actual health impact life course, I think we actually need specific organizations to bring all these things together, because I'm looking at some of these comments like what Colorado is doing, and we're kind of doing this on the margins of our time, and we need to have an organized approach to for public health. I'm speaking for public health and healthcare specifically, to be an organized voice to represent mothers and babies, so we can influence national dialogue and national policy.
And actually, I'm going to also put that question out to the audience, because it's clear, as Curtis just said from the comments, that there is a wealth of knowledge in the audience today. If people could type into the chat box how they're getting this type of work funded in their communities, that would be great for us to know. And if we have time, I will read some of those comments out. I'm going to ask a question that I'd like each one of the presenters to answer. We'll just do it in speaker order. But starting with Erica, what's the #1 workplace policy change needed in this country that you think would have the biggest impact on maternal child health, particularly for low and middle income workers? Like if public health, for example, needs to focus on one issue, what would you recommend that issue be?
I think that paid parental leave is a huge issue. It has benefits for mothers, for children, for fathers, for extended family, and ultimately for workplaces in terms of their ability, as other speakers said, to attract and retain high-quality workers and allow lower-income parents to continue working. So I would, from my perspective, paid leave and potentially subsidized child care are the two issues that I think would have the biggest impact on both parents and children.
Thank you. Curtis and Sharon, do you want to take a stab at that?
I think I want to just say this in context of public health policy in general. Those of us in public health, so I'm also the deputy health officer for chronic disease, And we work on a lot of various policies, but and I'm certainly no expert in this field, but I can't think of actually a more important policy as having equity in paid parental leave and more access to job-protected leave that actually impacts our low-income families than those two policies. I mean, I don't want to single out any specific policies that all of us are working on, but those are really kind of like on the margins. This affects a huge proportion of every single family in the United States, and the United States is lagging far behind everybody, and very few public health departments are actually, and healthcare organizations are actually focused or even working on this. So I'm very hopeful that the participants in this phone call can somehow organize together to do something about this.
And I will chime in on that. I think that I completely agree that paid parental leave with job protection is the most important thing we can do for families. And one thing is that in California we have the paid family leave program, but it doesn't come with job protection. And so unless you're already covered by the law that protects your job, which leaves a lot of people out, we hear from people all the time who feel they can't take advantage of the paid family leave program. They paid for these benefits out of their own paychecks, but they can't take advantage of it because their employer tells them, if you do, we can't hold your job for you. We won't bring you back to your job. So I think just adding that one key component, that any parental leave law needs to come with job protection and job security so people feel able to take advantage of it.
So I'm going to sound like a broken record, right, because I totally agree. Paid family leave is so important. And as we look at the data, and so we have California as a model, right, of what happens there, what happens with mothers, what happens with duration of breastfeeding. In California, the median duration rate of breastfeeding doubled among new mothers who took paid family leave. And that cannot be ignored. With so many mothers, we have a little under 30% of mothers that don't meet their intention to breastfeed at least 3 months because of the fact that they don't have paid family leave and don't have time to establish a breastfeeding routine. So I think it affects different things and affects long-term health for both the mother and the child, and I dare say even for the family. Paid family leave covers so much that I think it's just ultra important for us to get some sort of law to make sure that mothers have this available to them long term.
Well, I think thank you, Celia. I think that is an excellent note to end on. I feel very optimistic after this webinar, listening to the four of you. You're great champions for these issues, and there's so much more work to be done, but it's great to hear the work that you all are doing. I want to thank our speakers, and I want to thank all of the participants for joining us and for engaging in such a lively way in the conversation. We will send out a recording and a copy of the slides to everyone who registered. Thank you all, and have a great rest of your day.